The town of Carlton North has a problem that might sound familiar. The district has 10,000 people and only 2 doctors. That sounds overwhelming, but the community has rallied behind a new clinic that reimagines what a family practice could be if it was delivered by a team.
One of the great things about this design that we've made is you actually have 2 hallways here to kind of ease congestion from this hallway, which is a little bit bigger, into these other exam rooms where there's pocket doors on both sides. You know, we're not wasting floor space with a swinging door, but you've also got the 2 doors here to ease congestion from one hallway to another. So patients entering on that side, the physician coming in on this side. With 100 patients, 25 per physician every day, walkers, wheelchairs, family members, it could get quite congested.
Dr. Stuart Lockhart envisions the day when this new clinic will be staffed with a team of doctors, nurses, and other healthcare allies who could handle a flood of patients coming through the door. This place is built to be busy. Everything here is designed for a healthcare team who can spell off one another and pick up the patients orphaned by doctor retirements.
So maybe 45% of patients that are seen at this clinic don't have a primary care provider.
Lockhart says a new doctor is coming soon, and the clinic is working to onboard patients from the provincial wait list. However, as of a few months ago, the Upper River Valley was reporting 35 doctor vacancies plus another 14 doctor vacancies at the local hospital. The clinic has the attention of New Brunswick's health minister, who paid a visit last month. Dr. John Dornan says the province is going to deliver on its promise to support healthcare teams in community settings.
And we're on a very aggressive time schedule. Though we have committed to 10 clinics this year, some areas are very close to that. They're just on the edge of getting support from us to open them up as a collaborative care clinic.
He's not taking any further patients at this time.
Dornan says the province is ready to pay for overhead costs and the salaries of nurses and non-clinical staff. Plus, it is working on compensation to attract more doctors. You've got a really competitive situation out there. Can New Brunswick compete to bring people here?
No. We will lead. In New Brunswick, we will lead. We will have a better package here than anywhere in the country. And we are currently negotiating with the Medical Society so that we are rewarding physicians appropriately to give them a comfort level to continue to work in New Brunswick. And so I'm very confident, very bullish on this.
Dornan says New Brunswick won't offer the highest pay in Canada, but will sell a package that includes team support for early career physicians.
They would need to know that if they are away from the practice for reasons of holiday, having children, illness, or retirement, that their patients are cared for. Their patients are not dependent on them being there 365 days of the year. So that's attractive. The third part that will sell people in our clinics is a reduction in the necessity to manage their overhead, manage their staff, manage their paperwork. So that's a significant inducement. It's what students, what young physicians, what senior physicians have told us they want.
We've got some rooms at the front for allied health providers to come in. The idea here is that a patient could come in, they have an appointment to see an allied health provider. They don't have to wander through the clinic or be roomed. They're right there.
Lockhart says with more staff, he could offer more wellness clinics and weekend service. What's standing in the way?
I mean, I think this is a very new thing for New Brunswick still. For the longest time, primary care has simply been synonymous with, your family doctor and their office, and that's it. There isn't really anything else. And so now we're playing catch up a little bit.
The mayor of Carlton North thinks relief is just around the corner.
And you can identify and you can recruit, but eventually you have to pay them. So I think you'll see in the first budget of the new government that they'll have a bucket of money or an envelope of money, that how they refer to it as for these types of clinics, and that money will flow to the healthcare authorities, like in our case Horizon, and they'll start to hire people.